Hello everyone. I'm excited to share with you our pediatric cleaning protocols, which focus on integrating technical skill with the essential aspects of patient comfort. Our ultimate goal is to create positive experiences that not only alleviate anxiety, but also foster lifelong habits of oral health among our young patients. First and foremost, let's discuss the foundational elements of pediatric dental care. Regular checkups are vital for the early detection of dental caries, malocclusion, and developmental anomalies. Identifying these issues early on can lead to more effective treatments and better outcomes. Implementing preventative measures during the primary dentition phase is critical for ensuring proper dental development. This proactive approach can significantly reduce the likelihood of dental issues later in life. We recognize the uniqueness of each child's dental development journey. Therefore, we utilize age-appropriate techniques, modified assessments, and diligent monitoring of eruption patterns to tailor our care to each child's specific needs. Let's talk about creating a positive patient experience. Creating a comfortable and stress-free environment for our pediatric patients is essential. Here are key strategies to employ. Strategic humor. Appropriate humor can help lighten the mood during stressful procedures. It creates a friendly atmosphere and builds trust.
You want to try this straw? Say ah and close. Good job. You want to try it again? You want to try with some water?
Effective communication is crucial. We aim to establish rapport with our young patients through age-appropriate conversations and engagements. Using child-friendly terminology for our dental instruments helps demystify the process, making it less intimidating for the child. And this is my spinny toothbrush. And that's how we clean your teeth. Implementing positive reinforcement protocols, such as rewards for cooperation, encourages children to engage positively with their dental care. Here you go, you did such a good job. High five.
Nice job, Mary.
Our protocols include several distinct steps to ensure comprehensive care. The initial assessment. We begin with a thorough review of the child's medical history to identify any potential concerns. Behavior management. Appropriate behavior management guidance techniques are implemented to establish a calm and cooperative environment. Radiographic examinations. For patients with posterior closed contacts and children ages 5 and older, we conduct bilateral posterior bite wing radiographs to assess dental health accurately. This may vary based on the child's needs. Following the ALARA principles, we employ pediatric sensors, thyroid collars, and lead aprons to ensure the safety of our young patients during radiographic examinations. We document dental conditions using the Universal Numbering System. Dentition assessment. It's important to evaluate whether the child is in the transitional or permanent dentition stages to guide our treatment decisions. Next, we'll focus on cleaning and preventative treatment. Utilizing manual scalers and ultrasonic devices, we effectively remove calculus and biofilm from the tooth surfaces. Coronal polishing paste is applied to eliminate extrinsic staining, enhancing the overall appearance of the child's teeth. And then we ensure a thorough interdental cleaning with floss and irrigation has been completed. A complete examination of oral tissues is conducted to identify any areas of concern. It's essential to demonstrate effective oral hygiene techniques such as the bass brushing technique and interdental cleaning. We carry out detailed assessment for caries, periodontal status, and occlusal abnormalities to ensure comprehensive care. 5% sodium fluoride varnish is applied with a microbrush, and we advise parents to avoid food and drink based off the manufacturer's recommendations. To foster a trusting relationship with our patients, we focus on creating a welcoming environment through positive experiences. We develop a systematic approach to ensure appointments are stress-free. We establish age-appropriate reward systems that encourage positive behavior and compliance, and master age-appropriate terminology to make each child feel understood and engaged. Strategies are developed to reinforce consistent oral hygiene practices at home. and diligently track treatment outcomes and make necessary adjustments to protocols based on individual patient needs. Lastly, by prioritizing patient education, we empower families to establish effective oral hygiene routines that can last a lifetime. By implementing these evidence-based protocols and fostering strong partnerships between patients and providers, we can not only achieve optimal dental outcomes, but also pave the way for a lifetime of oral health for our pediatric patients.
Thanks for watching. Strengthen your dental team skills even further by heading to the next video. See you there.